If you're over 60 and eating these 4 vegetables thinking you're being healthy, you might actually be doubling your stroke risk without even knowing it. And the 4th one is probably sitting in your fridge right now. Look, I know what you're thinking. Vegetables are supposed to be good for us, right? That's what we've been told our entire lives. But here's the thing nobody talks about: when you hit 60, your body changes. The way you process certain nutrients shifts. Your blood vessels aren't as flexible as they used to be. And some vegetables that were perfectly fine in your 40s can actually become dangerous after 60. Today I'm breaking down exactly which vegetables you need to watch out for and, more importantly, why they become risky as we age. Here's what's happening in your body right now if you're over 60. Your blood vessels are getting stiffer. That's just a natural part of aging. The lining of your arteries, called the endothelium, doesn't work as smoothly as it used to. Your kidneys aren't filtering things out as efficiently. And your body's ability to regulate certain minerals and compounds changes dramatically. This means that foods which were once considered healthy staples can now contribute to blood clots, arterial stiffness, and yes, increased stroke risk. And the scary part? Most doctors won't tell you this during a regular checkup. They'll just keep saying, "Eat your vegetables," without specifying which ones might be working against you. Stroke is the 5th leading cause of death in the United States, and the risk increases significantly after age 60. But what most people don't realize is that diet plays a much bigger role than genetics in many cases. You can't control your age, but you absolutely can control what you put on your plate. Let's talk about the first vegetable you need to be careful with: spinach. Now, before you click away thinking I've lost my mind, hear me out. Spinach is loaded with something called oxalates. These are naturally occurring compounds found in many plants. In younger people with healthy kidney function, oxalates usually pass through the system without much issue. But after 60, your kidneys slow down. They don't filter as efficiently. When oxalates build up in your system, they can contribute to kidney stones, sure, but here's what's more concerning: they can also bind with calcium in your bloodstream. This creates calcium oxalate crystals that can deposit in your blood vessels. Over time, this contributes to arterial stiffness and calcification. Stiff arteries mean higher blood pressure. Higher blood pressure means increased stroke risk. It's a domino effect. And here's the kicker: 1 cup of cooked spinach contains over 750 milligrams of oxalates. That's a massive amount. If you're eating spinach salads every day thinking you're doing yourself a favor, you might actually be setting yourself up for problems down the line. But it's not just about the oxalates. Spinach is also incredibly high in vitamin K. Now, vitamin K is essential for blood clotting. But if you're over 60 and taking blood thinners like warfarin, which millions of seniors are, eating large amounts of spinach can interfere with your medication. It can make your blood thinner less effective, which ironically increases clot risk and stroke risk. The second vegetable on this list is going to surprise you even more: tomatoes. Yes, tomatoes. Specifically, we're talking about tomato products like tomato sauce, ketchup, and tomato paste. These are concentrated sources of something called tyramine. Tyramine is an amino acid that can cause blood vessels to constrict. For most people, tyramine gets broken down by an enzyme called monoamine oxidase. But as we age, the production of this enzyme decreases. If you're over 60 and you're also taking certain medications, especially MAO inhibitors for depression or Parkinson's disease, tyramine can build up in your system. When that happens, it can cause sudden, dangerous spikes in blood pressure. And sudden spikes in blood pressure are one of the leading triggers for hemorrhagic stroke. Even if you're not on MAO inhibitors, eating large amounts of concentrated tomato products can still be problematic. The high sodium content in most tomato sauces and ketchups compounds the issue. High sodium intake causes water retention, which increases blood volume and puts extra pressure on your arterial walls. For aging arteries that are already less flexible, this is a recipe for disaster. And let's not forget about the acidity. Tomatoes are highly acidic, which can trigger inflammation in the gut. Chronic inflammation is linked to endothelial dysfunction, which means the lining of your blood vessels doesn't work properly. When your endothelium isn't functioning well, you're at higher risk for blood clots and, you guessed it, stroke. The third vegetable you need to watch out for is one that shows up in almost every healthy eating guide: kale. Kale is often called a superfood, and for younger people, it can be. It's packed with vitamins, minerals, and antioxidants. But after 60, kale presents some serious risks. Like spinach, kale is extremely high in vitamin K. Just 1 cup of raw kale contains over 500 micrograms of vitamin K. That's more than 5 times the daily recommended amount. If you're on blood-thinning medication, this is a major problem. Your doctor prescribes a specific dose of blood thinner based on your diet and lifestyle. If you suddenly start eating large amounts of kale, you're essentially overriding your medication. Your blood becomes thicker, clot risk goes up, and stroke risk follows. But even if you're not on blood thinners, kale can still cause issues. Kale contains goitrogens, which are compounds that interfere with thyroid function. Your thyroid regulates your metabolism, heart rate, and blood pressure. After 60, thyroid function naturally declines in many people. Eating large amounts of raw kale can suppress thyroid function even further. When your thyroid isn't working properly, your cholesterol levels can rise. High cholesterol leads to plaque buildup in your arteries. Plaque buildup narrows your blood vessels and increases the chance of a clot breaking off and traveling to your brain. That's an ischemic stroke, and it's the most common type in people over 60. Plus, kale is another high oxalate food. 1 cup of cooked kale contains about 20 milligrams of oxalates. That might not sound like much compared to spinach, but if you're eating kale smoothies for breakfast, kale salads for lunch, and sautéed kale with dinner, those oxalates add up fast. And remember, oxalates contribute to arterial calcification and stiffness. Now, let's get to the fourth vegetable, and this is the one that probably shocked me the most when I first learned about it: celery. Celery is everywhere in health advice for seniors. It's low-calorie, high in fiber, and supposedly great for lowering blood pressure. And in some cases, that's true. Celery contains compounds called phthalides, which can relax the muscles in artery walls and increase blood flow. Sounds good, right? But here's the problem. Celery is also extremely high in natural sodium. 1 large stalk of celery contains about 50 milligrams of sodium. That doesn't sound like much until you realize that people often eat celery in large quantities, in soups, as snacks with peanut butter, in juices and smoothies. If you're eating 4 or 5 stalks a day, you're adding 200 to 250 milligrams of sodium just from celery alone. And because it's a healthy food, most people don't even think about it. They're watching their salt intake from processed foods but completely ignoring the sodium in celery. For someone over 60 with already compromised kidney function, this extra sodium can be a real problem. Your kidneys can't flush it out as efficiently. Sodium builds up in your bloodstream, pulling water with it. Your blood volume increases. Your blood pressure rises. And elevated blood pressure is the #1 risk factor for both ischemic and hemorrhagic stroke. There's also another issue with celery that most people don't know about. Celery contains high levels of nitrates. Now, nitrates aren't inherently bad. In fact, your body converts them into nitric oxide, which helps dilate blood vessels. But in people over 60, especially those with compromised gut health, nitrates can convert into nitrites and then into nitrosamines, which are compounds linked to increased inflammation and oxidative stress in blood vessels. Oxidative stress damages the endothelial lining of your arteries. Once that lining is damaged, it becomes easier for cholesterol and other substances to stick to the artery walls. This accelerates atherosclerosis, which is the hardening and narrowing of arteries. And narrowed, hardened arteries significantly increase stroke risk. So here's what all of this means for you. If you're over 60 and you've been loading up on spinach, tomatoes, kale, and celery thinking you're protecting your health, you might actually be doing the opposite. These vegetables aren't evil. They're not poison. But in the context of an aging body with changing metabolism, declining kidney function, and increased medication use, they can become problematic. The key is understanding how your body has changed and adjusting your diet accordingly. This doesn't mean you can never eat these vegetables again. It means you need to be strategic about portions and frequency. For spinach and kale, if you're on blood thinners, talk to your doctor about how much vitamin K you can safely consume. If you're not on blood thinners, limit these greens to small portions a few times a week rather than every single day. And consider cooking them, which reduces oxalate content. For tomatoes, be especially careful with concentrated products like sauce and paste. Fresh tomatoes in moderation are usually fine, but if you're on certain medications or have a history of high blood pressure, you might want to track how much tyramine you're consuming. For celery, be aware of the hidden sodium. If you're eating it as a snack, stick to 1 or 2 stalks. If you're adding it to soups or juices, count that sodium toward your daily total. And here's something really important, these risks are amplified if you're dealing with other health conditions. If you have chronic kidney disease, diabetes, high blood pressure, or a history of heart disease, you need to be even more careful. These vegetables can interact with your conditions and medications in ways that significantly increase your stroke risk. But don't just take my word for it. Research published in the Journal of the American Heart Association found that high oxalate intake was associated with increased cardiovascular mortality in older adults. Another study in the European Journal of Clinical Nutrition showed that high vitamin K intake from supplements and food sources interfered with anticoagulant therapy in over 60% of patients studied. And research from the American Journal of Hypertension demonstrated that even moderate increases in dietary sodium from healthy sources like vegetables could raise stroke risk in people over 60 with compromised kidney function. This isn't about fear. It's about being informed. Your doctor probably won't bring this up because they don't have time to go through every single food you eat. They're focused on prescribing medications and managing acute problems. But you have the power to take control of your diet and make choices that actually support your health goals. Look, aging is complicated. Your body isn't the same at 60 as it was at 40 or 50. The rules change. Foods that used to be beneficial can become risky. And vegetables, despite their healthy reputation, aren't automatically safe for everyone in every situation. The 4 vegetables we talked about today, spinach, tomatoes, kale, and celery, all have properties that can increase stroke risk in people over 60 under the right circumstances. High oxalates, high vitamin K, tyramine, sodium, and compounds that interfere with thyroid and kidney function all play a role. But the solution isn't to panic and cut out all vegetables. The solution is to be strategic. Pay attention to portions. Vary your vegetable intake so you're not eating the same high-risk foods every single day. Talk to your doctor about how your diet interacts with your medications. And most importantly, listen to your body. If you notice that you feel bloated, sluggish, or experience blood pressure spikes after eating certain vegetables, that's your body telling you something. Don't ignore it. Replace some of these higher-risk vegetables with safer options. Cucumbers, zucchini, bell peppers, and green beans are all much lower in oxalates, vitamin K, and sodium. Carrots and sweet potatoes are great for heart health without the same risks. Broccoli in moderation is fine for most people and provides tons of nutrients without overwhelming your system. And remember, this advice is specifically for people over 60. If you're younger with healthy kidney function and no medication interactions, you probably don't need to worry as much about these vegetables. But if you're in that over 60 category, especially if you have other health conditions or take multiple medications, it's worth paying attention. Your health is in your hands. Small changes in your diet can have massive impacts on your stroke risk. Don't let outdated advice or generic health tips put you in danger. Be informed, be strategic, and take control. If this helped you, hit subscribe so you don't miss the next one.